Welcome, and thank you for joining us for this self-direction drop-in session hosted by LIFEPlan CCO and Advanced Care Alliance of New York. In this session, we'll review the basics of self-direction services in New York State, including the roles of care management, support brokers, fiscal intermediaries, and families within the circle of support. We'll also discuss startup budget approvals, collaboration agreements, reimbursements, onboarding processes, and common questions families and providers may experience throughout the self-direction journey. To explore more educational webinars, provider resources, and topic-based materials related to intellectual and developmental disability services, visit the provider resources pages on acany.org or lifeplanccony.com. There, you can access past webinars, virtual summit sessions, presentations, guides, and additional resources designed to support providers, families, and professionals across our communities. We hope you find this session helpful and informative.
Good afternoon, everyone. My name is Jenny Young, and I'm one of the directors of Provider Relations for ACANY and LIFEPlan CCO. We appreciate your time and attention to participating in this webinar to help members with self-direction services. To ensure sound quality throughout the presentation, all attendees are muted without the ability to unmute themselves. If you are having trouble with your audio, please notify us in the chat box so we can assist you. We welcome and encourage you to ask questions during the presentation using the Q&A box. We have reserved time at the end of the presentation to answer questions. A PDF of today's PowerPoint will be emailed with a post survey after this presentation. In the coming weeks, the PowerPoint will be posted on the Provider Relations page of both ACANY and LIFEPlan's websites. Please share your feedback and ideas for future presentations. Most importantly, information on self-direction can be accessed on our websites for reference and referral. Welcome. We're excited to have you join us today. Thank you for taking the time to be here. As we begin this series of webinars and drop-in sessions, we'll start with a quick review of the basics for newer brokers. Today, we'll explore how the Circle of Support work together to effectively support our members. So to begin, we're going to discuss who is on the team, the Circle of Support, and their responsibilities. So firstly, we have the person receiving services and their family. They hire staff, they schedule staff, they are the ones that will be coordinating backup staff as well as training the staff on services to provide, and they also end staff services. They choose the goals, the services, and the community programs that would be either direct provider purchased, agency supported, or self-hired. The care manager plays a big role in the process of assisting the family through the self-direction process as well. Once a member is enrolled with the CCO, the care manager is responsible for assisting the family with the person's goals, needs, and wants. The care manager provides a comprehensive service and support to the member, and the care manager will complete an assessment when they first meet the member to help direct what the services will be and the providers that will be working with the member. CCOs are all encompassing in that they help the member with their IDD needs, their health needs, their housing needs, as well as medical and any other services. The care manager really assists the member to be able to secure those services and supports. The care manager is a starting point when it comes to obtaining services for the member. They help develop and maintain the life plan. They also explore supports and services to help the person to reach their goals. The care manager completes and submits documents for the self-direction process to get started and approved. And they also assist the family in connecting to the FI or the broker. The support broker will develop and maintain the budget that will assist with funding the services and supports. They explain the community services and supports that are important to the person, and it needs to be consistent with the life plan. The broker also assists the family with obtaining approvals, onboarding staff, and completing reimbursement submissions. The FI is the employer of record for self-hired staff and the budget authority. The FI will verify staff employment qualifications, they do background checks, they provide trainings, and they process timesheets, service records, and payroll. The FI tracks the budget expenditures and they will send it out to the CCOs, the broker, and as well as the families. The FI also assists the participants by attending the annual and semi-annual life plan, providing assistance with staffing, support, services, and budget expenditures. And the last group that is listed here for the circle of support would be friends, support staff, and community/work connections. They provide support and assistance towards the person's goals. The family/the member's role. The family attends the OPWDD self-direction information session. After attending, OPWDD will send the family confirmation of attendance via email, and that is necessary because OPWDD requires the brokers and the FI to submit that with the packet. The family will need to send this to the broker. The family also will choose a broker. After interviewing brokers, the family can decide which broker they're going to work with. And once the broker is chosen, the family will sign a broker agreement. The family also chooses the FIs that they would like to work with. And they would submit the onboarding documented requested by the FI before they can start working together. The care manager will assist typically with providing those documents, as many of those documents are documents that the care manager is a part of in order to submit that to the FI. And the onboarding timeline and the processes vary by FI. The care manager role. The care manager assists throughout the process for self-direction. Again, like I said, the care manager provides services and assists the family with getting IDD services, community-based services, and services of interest to the member. And so the care manager will submit the documents to obtain self-direction eligibility to OPWDD. And after that approval is received, that form is called the NOD9, the care manager would assist the family with attending, the care manager also assists the family with attending the OPWDD virtual session if they have not already. They also assist with locating a broker and an FI, and they submit documentation to the FI in order for the broker and the FI to work with the member receiving self-direction services. So the care manager would complete an addendum to include FI and broker information to sections 4 and 5 of the life plan. And once this finalized life plan is received, the FI would review it and submit it to OPWDD for startup broker services. The care manager also meets with the circle of support to discuss the self-direction services that the member is looking to receive. The broker's role is collaborative in nature with the care management team and the family. And so, following an interview with the family or the member, the broker will send a broker agreement for the family or the member to sign. They connect with the care manager to obtain the documents requested by the FI, and they complete the intake packet and submit the required documents to the FI. The timeline again varies for the FIs for submission to OPWDD. Once approved, an email is received by the circle of support. So that would include the family, the broker, and the FI. And the FI coordinator will schedule a launch meeting with the circle of support so that they can get started with the next steps of the process. Following the launch meeting, the broker will work with the family to decide the services and reimbursements that will be used. The life plan is used as a guide. The FI receives the interest inquiry for services and notifies the broker or the care manager, depending on who's reaching out on behalf of the member, of their onboarding process. The FI receives and submits the required documents for startup approval, which those documents are sent by the FI to OPWDD. Once the approval email is received from OPWDD, the FI intake coordinator or their staff will notify the broker, the care manager, and the family of the next steps, which may include setting up a family account on the portal that is used by the FI. And the family will use this to review broker billing, payroll, and submit for reimbursements for approved services or items. And during the launch meeting, the FI will review the practices and procedures for working with them. Budget planning. So the team will meet to discuss the services, staffing, reimbursement, community classes, memberships, transportation, and service providers that would be of interest or that the member may be already using that would now be included in the self-direction budget. A follow-up meeting can be scheduled over the once the costs are calculated and added to the budget. The broker then will input all the information that was discussed during the meeting into the budget template. They review the budget with the family, and then they would submit the budget and any additional information or documents to the FI for review and submission for an initial budget approval. The broker and the family can begin to search for staff, if applicable, to get their contact information and all the required documents ready so that once the budget is approved, they can submit that staff to the FI for onboarding. The initial budget approval. Once the budget is approved, the family can begin submitting reimbursements, onboarding staff, and paying for services. Please note that expenses paid out of pocket by the family before the budget is approved will not be reimbursed. So it's very important that families and members wait to pay for services or to start different classes or services after the budget is approved. That way they will be able to be reimbursed for those expenses. Better together. So we value strong collaboration with independent brokers to improve communication, streamline referrals, and enhance member outcomes. If you would like to collaborate with us, please complete the collaboration agreement. I have included a sample of how to fill out the form as well. At the top, information would be my information on our customer service information. In the middle section would be where it says provider agency. You would simply write independent broker there, and then your name and your contact information on the following lines. And then on page 2, you would sign, print your name and date. And like I said, this is for us to collaborate and better serve the members that we share. In addition, we also have the opportunity for you to complete the DSNY. It is a directory that allows the care managers and families to contact service providers, including brokers, who are accepting new cases. It is a way for you to promote broker services, and that link for that can be accessed in the chat. You would complete it, and then when families or care managers are looking for a broker, they would be able to have your name be populated and they can reach out to you to connect for broker services. And lastly, if you think of any additional questions after the webinar, you can feel free to contact me at jenny.young1@ccany.org. At this time, we can open up the floor for any questions.
Hi, Jenny. So the first question we have in the chat is related to FI. Some FIs are telling care managers to only add FI to the life plan until the initial budget is approved. Would you be able to clarify this?
So for that, I would defer to the FI. Each FI has their own process. And so if you're working with an FI and that's their requirement, then I would follow up with them for clarification on that. I can't speak to the FI's procedures. Thank you for the question, though.
The next question is Jenny asked, what items and services can be reimbursed under self-direction?
So the FIs have a process called prior approvals, and each of them, the way you would submit a prior approval is different, but you will be connected to a staff at the FI that you're working with that will let you know what would be approved. Typically, items that are reimbursable are community classes, and if you reach out to me via email, I can send you a list of what's reimbursable and what's not. It can get a little, I don't want to be too specific, but I can send you the list as a guideline. And then if you have a specific question, I can definitely follow up with you on that.
Wonderful. The next question is, can you clarify the collaboration agreement?
Okay, so in the effort to work together and provide quality service to our mutual members, we have the collaboration agreement. So once you sign that, it is us mutually agreeing to work together and provide services to people that are in need of self-direction services. So as a broker, if you have a member that is receiving services with ACA or LIFEPlan and you wanted to reach out to me, you had a question, we would work together to be able to assist our mutual members.
The next segment of that question is, should LIFEPlan care managers expect to see these for members who have self-SDS services in a broker, or is that only for certain situations? This is in regards to the collaboration agreement.
So collaboration agreements, most providers have been working with the CCOs and have signed collaboration agreements, to my understanding, but I can follow up on that second part of that question, and I can send you an email with the answer directly.
Wonderful. Greg asked, I represent an FI provider. FI and broker services should be added to the LIFEPlan at the time of the startup budget approve it, as it is when those services begin. Community Hub, such and such. Was this a question, Greg? I'm sorry. We're going to move over to the next question. What steps are required to transition current services into the self-direction plan while keeping DDP agency on? This is a question from Shirian.
So once the self-direction budget is approved, that provider will be added. And so that process would happen with the care manager as well as the FI. They would assist with, if the family's staying with that provider, including them into part of the self-direction budget.
The next question is, what are common reasons agencies get removed from a self-direction plan, and how can we prevent that?
That providers get removed from the self-direction plan?
Yes. What are the common reasons agencies get removed from a self-direction plan, and how can we prevent that?
That would solely depend on the circumstance with the family and the member. So that would be a question for the family and a discussion to be had with the circle of support, including the care manager and the broker and the family.
Okay, wonderful. And then the last person just asked if this is being recorded and can we watch this again?
Yes, it is being recorded. There will be a link posted to the websites that we can be able to watch it again, as well as the information shared in the slide will be provided at a later date as well.
Wonderful. Are there any additional questions? It does not look like there's any additional questions.
Okay. Thank you all very much for joining and for the helpful information in the chat as well. We appreciate you taking the time to join us today. We value the opportunity to collaborate with you, and we will be having a follow-up drop-in session in the coming weeks. So please feel free to register for that, and we'll be able to have more detailed discussions at that time as well.